Distinguished participants, as it became a traditional Congress, on the first day, we have a session with regard to public institutions and organizations' activities with regard to accessibility in informatics, and I will be moderating this session. Now, I would like to invite our first speaker, the representation from Ministry of Health, and then we will have speakers from Ministry of Justice, and then from Information Technologies and Communication Authority. The first speaker is dear Cihan NİŞANCI. Floor is yours. Microphone is needed for live broadcasting. Thank you very much. Distinguished Chair, distinguished participants, I would like to talk about the activities of Ministry of Health with regard to people with disabilities and providing barrier-free services. Here is my presentation plan. I would like to inform you about the measures that we've taken in hospital to facilitate the lives of people with disabilities. As you know, people with disabilities take an appointment before they come to hospital, and they have a priority during the there is a reserved spaces in the appointment system. So when they enter the appointment system, they have a priority. Once they enter their ID number, they're automatically given additional capacity in all hospitals. So we make sure that they can get an appointment. So within the first 6 months, around 120 million capacity has been opened for the entire country, and 10% is reserved for people with disabilities. And around 7 million appointments have been given to disabled citizens. Another practice that we have in appointment system is that if someone gets an appointment and does not show up, then they cannot get any other appointment for the next 15 days. But people with disabilities are exempted from this rule. And those who are coming directly to hospital are also giving priority for the clinic services. As you know, we have homebound health services for those who are using either medical devices or bedridden patients, or those who are above the age of 80. They are receiving homebound healthcare services. We provide the same services for people with disabilities as well. So we have created 791 units, and with around 1,600 teams, we are providing those services with 1,600 personnel. We have reached to around 3 million patients so far. And only last year, we have only provided services to 420,000 people. We are providing our services in many different implementation, injections to examinations, wound care, dressing the wounds. So almost all services provided in our hospitals are also provided for people with disabilities or people in need at home. Also, those individuals, above the age of 80, those completely dependent patients, previously they had to come to the hospital in order to renew their reports. So Now they are no longer obliged to come to hospital. We send teams to their homes and we renew their reports in their homes. Again, 11,000 citizens are provided with these services this year. Dental services, dental hygiene is important for people with disabilities because they were having some difficulties when they received those services. Therefore, we have started an activity. In 21 cities, we have created 25 dental health centers and 38 disabled centers have been created. Around 13,482 people with disabilities have been treated with their dental care. As the head of department has mentioned in the presentation, accessibility is important and we work quite hard in this field. In 2020, our ministry updated their forms, and we have updated ourselves depending on these forms. And in 2024, we have increased our accessibility rate to 64%. Within these forms, there are certain steps enabling you to access a lot of services, and we made sure that they are in place. Pedestrian safety, car park services, accessibility in the exit and entrance, information on the lifts, and to sidebars on the stairs. So in all our hospitals and health centers, we are doing our best to make them accessible for people with disabilities and for the elderly. Another important aspect was preventive activities. Starting from prenatal up until the bedridden process, we are with our people with disabilities. We are conducting screening services, genetic screening, so that we can prevent disability. So starting from the birth, we are also scanning babies to prevent future disability. There are newborn hearing tests, vision tests, and other tests are administered to newborn babies. Also, we are conducting information and awareness raising services so that people can prevent it in premarital period. Also, in the first year, at least 9 times, and up until the 6 years of age, we are following our children for 16 times to make sure that they do not face any adverse health conditions. Our Accessible Health Communication Center is awarded today, and let me share some information about this application. As you know, people with hearing disabilities cannot talk, so there is a communication problem, and it is quite challenging to get any health services under such circumstances. Therefore, we have created ESM application. ESM is a mobile application providing services on 7/24 basis. So it's like they have their sign language interpreters in their mobile phones. They can download these applications free of charge from iOS and App Store. And our users with hearing disabilities can get services by using this sign language interpretation. And the service is entirely free. The application itself is free to download, and also the services provided are also free. Usually these applications are using the mobile data of the users, but this application particularly will not spend your mobile data. Once people with disabilities register into the system, they inform us about their location, about their stage situation, or they can share some pictures with regard to what they need. and all those informations are collected on the center, and we take action quite swiftly. We get in touch with them and we resolve their problems. So what is included in the services? Let's say if they are facing a urgent health situation, those people with hearing disabilities can call an ambulance. Since they cannot talk, they cannot call 112, and it was a big challenge. Therefore, we have created this SM application. Now they will be able to call an ambulance or reach to our center. One of our colleagues said that up until we have this application, I wasn't able to sleep well because I was thinking what will happen to my hearing disability parents? What if something happened to them, and how they would be able to reach the doctors or hospitals? But now with this application, they can also have this capability. No matter where they are located in the country, they can get priority appointment to all physicians in all hospitals. And what is most important, once they put their step in the hospital or in the doctor, they can easily get a sign language interpreter so that they can communicate themselves well during the examination, because sometimes they cannot really explain their condition well to the doctors. They were doing some mistakes, but thanks to SM, with correct sign interpretation, these problems are also resolved. Thank you very much for your attention. If you have questions, I will be happy to answer. I had a problem a couple of years ago that was not regarded to the technology, since we have the head of department here. I cannot walk. I burned one of my feet back then. Normally I can go to hospital, but when my feet is burnt, I couldn't leave home. I needed dressing on my wound. I called the ambulance. Can you take me to hospital? I need dressing, wound dressing. They say we are only sending ambulances for urgent conditions such as heart attack or with the fatal risks. Municipality is saying, yes, we have a car, but we do not have personnel to get you down from your flat. I called the Ministry of Family and Social Services. They said we do not have such personnel and we don't have vehicles. I don't know if things have changed since then, but there are certain issues that there are temporary disability conditions. Is there anything that can be done? There is a hotline, 444038 is a hotline that you can call this number and you can leave your demand. they asked me if I'm registered to home care services. I was disabled, but I was able to do my job. They said you are not registered to home care. So do we need to be registered? Yes. It is essential to be registered because our home care services will provide you what you needed. At the moment, I don't need that, but still it will be helpful to register for you to register. If I am registered now, of course, if you are registered, thank you very much. Thank you. Any other questions? Apparently not. Then we would like to thank Cihan NİŞANCI for this presentation. Thank you. Hopefully, it contributes to our work. Now, in this session, I would like to invite our second speakers. Minister of Justice, Judicial Support and Victim Services, Investigation Judge Ahmet HANER is kindly invited to the floor. He will talk about their activities with regard to access to information. Can you please wait for this technicality? I think it's ready now. Go ahead. Distinguished Chair, distinguished participants. I think we have another technical problem, but let me start so that I can use my time effectively. Today, I'll be talking about the services provided by Ministry of Justice. We are calling it accessible justice. Ministry of Justice created a unit, which is Judicial Support and Victim Services Directorate. So we have it in our own all directorates. And one of the most important services that we provide here is the approach that we have for vulnerable groups. As Ministry of Justice, we're aware that people with disabilities are not only needing physical accessibility, but they also need accessibility in information, in some resources and services. Therefore, our units are playing a leadership role. So what do those directorates do? For people with disabilities, for women, for children, those victims of crime, starting from their first moment that they have entered the courthouse, especially for these vulnerable groups, when they apply to our directorate, we inform them about their rights. Let's say they are in the courthouse as a witness, and what are their rights and responsibilities? We inform them about these issues. So we explain them the requirements. If there's a need to refer to another unit, let's say, if they need to get for judicial support, they can also have this capability. If they need psychosocial support, because courthouses are not the most friendly places when you are in the court, it might be stressful for you. And if you are under this heavy stress, then the courthouse is providing you either psychologist or some other services. Of course, there are other services of our directorate, but one of the services that provide for disabilities is if they cannot access the services on their own, they are given a case manager, and with this case, they can present this to the judge, and all of their activities and procedures are conducted with the presence of an official from the courthouse. The interview rooms, we have judicial interview rooms. They are present in 175 courthouse, and people with disabilities are having difficulty with regard to give their statements. It's not only a difficulty for people with disabilities, but for all citizens. They might be feeling very stressed when they want to give their statement. So we created these rooms that the victims and the defendants are not coming face to face. There's a waiting room, there's an observation room, and also we have interview rooms. During the observation room, when the people with disabilities is going to give a statement, not only people with disabilities, women and children are included, and all vulnerable groups are included. Before they give their statements, the official support officers welcomes them and explain their rights and responsibilities, and also trying to alleviate their anxiety level. And then the public prosecutors or the service system, there is another room connected to the court room. Then this officer, assistant personnel, brings them to this room. Here, there's only the victim and the interviewer. In other rooms, they are connected to other rooms during the prosecution. The prosecutor asks necessary questions, and the interviewer just adapt the questions accordingly. As I have mentioned at the beginning of my presentation, one of the most important aspects for us is to have a different understanding. We are not only focusing on physical accessibility, but we want to make sure that all victims can actually have right approaches. We have prepared two guidelines: approach to victims and approach to witnesses. These are not prepared only for the judiciary personnel, but also prepared for the police, health personnel, and also for our ministry, because they are the vocational groups who have the most contact with victims. These three organizations are mostly in charge contact with them. The most important aspect of this guideline, especially for people with disabilities, we also explain what type of an approach is necessary for all disability groups: to victims, how to approach the witnesses, especially with physical disabilities, orthopedic or visual or hearing disability is mentioned, how it should be approached. They should be approached. As Ministry of Justice, we have created an accessible justice workshop. In this workshop, we invited all civil society organizations working in this field, in the accessibility area, or people with disabilities. What we ask from those civil society organizations is to tell us what type of problems that you encounter in justice system. We wanted them to bring the problems and their recommended solutions. And together with this data that we gathered in 2003, with the confirmation of the Ministry of Justice, we have created a working group for disability services. So what have we done after that? First of all, we have noticed that people with hearing disabilities are suffering the most in terms of accessibility to justice. And in Turkish Sign Language, judicial terms are not included. Since they do not know this term, they don't know their rights, they don't know where to access. So we have prepared some brochures about their basic rights. What is judicial assistance, what is what witness, what is defendant. So we have trained them with the most basic concepts and rights. We have created 66 videos, and last year this project has been awarded. I want to show you one of our videos. I don't know if I'll be able to do that. Can you put it, please? If you have noticed, that is what I'm trying to explain. There is no sign language words in legal terminology. Just one concept is explained in length. Therefore, we have created these videos so that they can understand about their rights and they at least know how this legal terminology can be also covered by sign language. As my previous colleague has explained, we are also trying to develop we are developing an application for people with hearing disabilities, and hopefully it will be functional in 2026. In all, so there are 30 sign language interpreters in our ministry. They work in 30 courthouses, but those people with disabilities in other courthouses cannot use the services. In order to make sure that they can access it, so we are developing a mobile application, and it will be disseminated to the rest of the country. We believe that it is quite important because when you enter the ÇAÐLAYAN courthouse, even people without any disability will have difficulty to find the room of the prosecutor or where is the judicial assistant room. They cannot find it very well. So this will help them to have a right access. Therefore, we believe it's important. E-hearing system is created. We have prepared it in Manisa Hospital. This e-hearing system, if people cannot show up in the hearing because of their disability or disease, they will use this application to be connected to the courthouse. The third technological innovation is we have document editor. We work with lawyers. The visually disabled lawyers are having difficulty to read the documents, and everything is through UYAP, and this editor, this Windows editor, is also integrated, and our IT department enabled that. As Deniz Hanım has mentioned, accessibility is essential. As a result of this workshop, Adalet Go TR. So all of these areas, the judge, lawyer portal, mediator portal, are now accessible. How they are accessible? I have created a slide here. Enlarging the text, finding connection, reading the text, reading the selected area, dyslexia-friendly area. So all of them, the main services are also accessible. And apart from that, they are the public prosecutor's website are also accessible. There are many areas with regard to accessibility. And judicial assistance application forms are also accessible. And they are uploaded to our website. So these forms will be accessible. And hopefully through the end of this year, we will make them ready. The second one is the sign language interpretation. That's also quite important for us. I mentioned about the mobile application. These are different from each other. So these are, but sign language interpreters, the visual sign language interpreters, will be able to use during the statement taking or the questioning processes with judges and prosecutors, because
so in order to prevent this capability, we also would like to establish a center for the expert witnesses, and also all the different courthouses all around Turkey will be connected to that, and that's what we would like to develop with this application. And also we are developing some training modules for the personnel of justice, and also we just would like to aim at decreasing the number of the victims in that sense. And up to now, we have provided trainings for 781 personnel, and also that is the basic training in this sign language interpretation. And also in the courthouses, 42 courthouses have the certificate of accessibility. And as of 2015, so more than 56 million Turkish liras have been spent to provide our support. That's all about my presentation. Thank you very much for listening to me. If you have any questions, I'm ready to answer. We thank you, Ahmet Bey, for your presentation. And of course, access to justice is so important in accessibility, of course. For a few years as a pilot implementation, some visually impaired individuals, we are organizing some work. And also when we send our students to that center, it was not suitable to provide those or to meet those demands. So as far as I understand, so a visually impaired individual can also work So there are many classes that were taken and many trainings were given. And also some of our students had more than 150 shots in a minute. And at the same time, they can listen to the screens, the video screens, and at the same time, without a need to repeat, they are also able to write down what they have heard. So for this, of course, our work is still ongoing, and we're trying to generate bigger projects in that sense. And of course, the behaviors and the attitude of the individuals that's also another important thing for us. And the harmony was good during that practice. And he was sad that they want to work with them. But of course, the Ministry of Justice must apply, and then the individuals must take the exam, and then if it's okay, they have the right to work. And we have heard that Ministry of Justice has given an advertisement on that. And as the personnel from the Ministry of Justice, if there is a very well qualified person is present there, it will be really good. But it didn't work because they do not want to employ disabled individuals. But our candidates were so suitable. So there is also EKPSS exam, but our candidate should not wait for EKPSS. But unfortunately, we were rejected. There might be that the capacity is full for the disabled individuals, but when we talk to the authorities, so there are also some experts just that are waiting somewhere in the university, or for the individuals who had a 4-year of university education, we know that they are being assigned in that sense. So they can get employed by signing a contract at least. Of course, there is a commission there to make those assignments. And also I can exemplify this. In 2024, a law graduate with a visual impairment could be assigned in 2024, and that person was assigned as a judge. And for that reason, if they are being assigned as a judge, of course, they can do some other services in the courthouse. And also that is the perspective of the Ministry of Justice. And the individuals with visual impairment can be assigned. And if we can have some further talk on that, it would be great for us. And if there is something that we can do, we'll do, of course, our best to provide our support. And we are inviting people from different grounds. And also there are some different concepts like just for Windows, and also within our general directorate, we have taken necessary steps. And of course, accessibility in all those services, they are all being included, and we are also open to these talks. And I'm also the member of Altınokta Köyler Association. We thank Ahmet Bey for his presentation. Of course, getting an access to justice is a critical thing. And right now, for the last presentation of that session from the Information Technologies Presidency, I'd like to invite our speaker to have his presentation. In his sector, he is also going to inform us regarding barrier-free information in his sector. Dear participants, I'd like to welcome you. Today in the electronic communication sector, I will exemplify some of our work within this area. First of all, before mentioning our work, I will mention national and international legislation. As you know that the first Human Rights Convention was on protecting the rights of the disabled individuals, and that belonged to United Nations Disabled Rights Convention. And also in our country, there is also a legislation, and also it is still an ongoing legislation in our country. So the public institutions are also conducting their work for the sake of the disabled individuals that are being assigned in their bodies. And there's also Information Technologies and Communication Institution. It also assumes responsibility in our sector, and also the standing point of our work is the legislation regarding the electronic communication. And the legislation numbered 5809, Electronic Communication Law, deals with many important areas. And of course, the needs must be paid attention in order to meet the demands of the stakeholders. And also it must be inclusive and open to coordination, and facilitate the work of the disabled individuals must be given the best priority. And also regarding the services for the disabled individuals, there are also some rights that needs to be assumed. And also the Information Technologies and Communication Institution, thanks to that legislation, for every single citizen, including the disabled individuals, they must have a place and they must have the right to get an access to all these areas. And also we have established a group, and also in the electronic communication sector, what the needs of the disabled individuals, and to make use of the services, what needs to be done. These ideas have been put forward, and also this institution has been still continuing to work in that regard. And also to create an equal environment for all citizens. Since 2011, there are some facilities, and also in all our work that are continuing since 2011, there are also some social projects, and also it provides some protection for the disabled individuals. And there are also some advantages being brought in that regard. And also the older legislation have been united in that regard. And also when we look at the advantages that are provided here, first of all, we can understand that the greatest liabilities is that the veterans and also the relatives of the martyrs must also have an access to the electronic and communication services with a discount rate of 25%. And that is the minimum percent, that is 2025. And in some also places that have been some 30 to 35% of discount for the relatives of the martyrs and also for the veterans themselves. And there are also online processing centers, and everyone can do their transactions online. And also the people working in the electronic communication sector might have some different tasks on that online platforms, and also those transactions can be diversified without neglecting the needs of the disabled individuals. So these are the liabilities that we are provided. And there are also video call center, and for the individuals with visual and also hearing impairments, there are also some opportunities provided for these disabled individuals. So thanks to that video call center, they can also use the sign language to correspond with the other sides. And there is also another liability that we are providing, that is the written call center, and also for the individuals with visual and also hearing disabilities, we also provide that service for them. And there are also some accessible branch maps. And the branches of the shops must be viewed online, and also their locations and what accessibility features they have or they hold must be declared. And that's also another liability that we have provided. And also on this call center, whenever the disabled individuals call them, they are immediately getting connected to the necessary bodies without facing any challenges. So on that call, they can talk about their problems with the customer service provider. And that's also another liability that we are providing. And at the same time, the accessibility of the internet websites. And also in 2024, there was a decree presented by the presidency, and also it became a liability to provide these services for the disabled individuals thanks to that decree. And all these services have been united under one umbrella. That has been also viable, and that might be in accordance with the standards of getting access to the websites. And on the other hand, the people working in the electronic communication sector and also the services that the disabled individuals must have, this equal opportunity must be given to every single citizen, and there must be some informative talks 4 times a year in that platform. So this link must be shared. And there are also some people that need to be socially supported. So in every quarter in a year, so we are also following the reports being sent. And there might be some missing points in those reports. And also we conduct some audits. For that reason, those reports are of great importance to us. And when we look at the other liabilities in tariffs and also in services, there are also some voice messages being sent to the ones who are demanding that information. And data services are also being shared. And also the information regarding the location of that individual will also be shared in that platform. And also there are some work that we conduct. And for the individuals with visual impairments, if they demand, their bills or their receipts will be shared then with Braille alphabet. And in another legislation, there are also emergent call center. And also the people with hearing impairments can use this platform. That's also another liability which is provided. And in another legislation, in the legislation regarding the service quality for the disabled subscribers, also to increase the quality of the services must be maintained. So in conclusion, within all these regulations, within all these sectors, basically, all our disabled individuals, in order to facilitate their lives, we have taken some concrete steps and we follow to have those concrete steps as a result of the inspections that we are conducting and as a result of the feedback that we take from the NGOs. We try to update ourselves, and also our institution has been continuing to work in that regard. That's all about my presentation. Thank you very much for listening. If you have any questions, I can answer. We can just have only one question. Thank you very much for your presentation. So in the earlier presentations also, we have seen the same thing. I am the General Director of an R&D company, and in digital accessibility area, we are one of the few expert companies, and we are developing some software programs in this field. In the earlier presentation and in your presentation, there are some contracting points. In some parts of Deniz Hanım's presentation about web accessibility or accessibility of the occupations, it may not be possible to solve the problem just by downloading a tool and then we can solve the problem. So that's something conceptual. Tomorrow we also have another presentation and we can talk on that elaborately. So web content accessibility guideline it is. 2.0, that is the updated version, and according to this guideline it must be analyzed, and when it's developed it needs to be done that way. We need to have some further work, and 98% of the websites are not accessible. For that reason, about this issue, if there might be contribution from our company, if we can provide something from the private companies, we'll do our best, of course. We can assume responsibility. And regarding the accessibility tests, we can also engage to this. That has been turned into a legal responsibility rather than social responsibility. And after this meeting, we can also talk elaborately on this about our support. Thank you very much. So the accessibility tool That's something like an add-on. So in this control or checklist, if it has the qualifications that we are looking for, we will accept that, but possibly it will not meet the requirements of our demands. For that reason, there needs to be a revision work. But as for the practices being made by the Ministry of Justice, it's been very useful. And also in the monitoring bodies, and also in some of the boards, we have given them to present their practices. But we are taking our time and working step by step. We're having that approach because that is the area of technology and it's being developed very fast. Thank you very much. In recent times, about these topics, we have conducted an inspection that was a general inspection. And about these, we have inspected the people involved in that mechanism. And like it is in the Ministry of Justice, we have looked for also the standards. So the main thing is that they need to be in accordance with the guidelines. And we do not have any application that will have an inspection on. So the results were low in percentages. For that reason, the good practices will make a good example in that regard. So when we request for the reports, we will request for an assessment period like those in EU legislation process. So what is on the agenda is the A-level assessment. And in order to test how accessible our websites are, there are also some checklists to follow. And about that, if you have some further information, we can share that information with you. And also the people working in the information departments, for them it's necessary to get familiarized with those standards, with those guidelines, because it's getting closer in time, and for that reason we have to work on that. Do we have some more time? We can get another question. Yeah, so of course we have very valuable work when we compare ourselves with Europe, but I have a small criticism, especially I'm checking how accessible the electronic communication websites, because there are tariffs and also contracts. But what I see on those websites is that there is no accessibility icon. As a normal citizen, I have to scroll in it. Sometimes it's at the bottom, sometimes it's in the middle. It must be in a fixed place, for example, right at the top or left at the top. So that button will possibly not be enough. But it's still being used for some institutions. But what you say is important, because we have had those problems, those similar problems. For example, when you open a Word document, it's visible there. Yeah, there might be some inconsistency, but the accessibility provided by that button will not be enough. So it's all about the infrastructure of that web page. So to make a building accessible, it's about the structure of a building. You add, for example, an elevator. You also place ramps. So just starting from the foundation level, including the elevators or including the ramps or some stairs, you build it. And that's what we want to have as a website. And also the people who has more than 200,000 subscribers should be also included. And we're talking about the same inspection. At the bottom of the page, under the title of accessibility, there's a link. But it's really very hard even for us to find. So a disabled individual, it will be too hard for them to find. On the contrary, it must be an easy way for them to get an access to that site, to that link. And so this regulation dates back to 2018, but also there were some earlier stages dating back to 2011. For the disabled individuals, for the elderly people, if there are some further services provided, from all sides, we must do our best. And I can contribute by saying, as the final words, in 2011, regarding electronic communications, there were some arrangements in 2011. So that was among the first important steps taken in our institution. Those steps were taken, and many disabled individuals are getting an access to the internet services with that support. And also in 2012, the article was added for the processors having more than 200,000 members were also added. Of course, the conditions in technology are always changing, so lots of things have changed since 2011. So we have always mentioned these advantages, so these facilities so far. For a temporary time, we can also accept these, but when we have a look at these, full accessibility cannot be maintained right now. But thanks to AI, maybe 5 years later, they might be enough. But under modern day times, the full accessibility cannot be met. And even the codes alone are not enough. And of course, the user's experience and also some other methods should be put forward. For temporary status, they are okay. For some emergent situations, we are also using them. But for an absolute solution, we still have to wait. And I believe that the concepts that you will share is being expected by everyone in the sector. And if there are some misinterpretations, also you need to correct that. And because there must be some misinvestment, so in order not to give some economical harm, they need to be corrected. So in a very short time, these regulations will be announced, will published, but there is really a limited number of that excluded websites. And in case of emergencies, even we request for the media to be accessible. So as soon as possible, they need to establish that examination commissions, because we haven't identified the number of people, because the size of the companies may vary. They can step by step have a look at the checklists, and as we have our guideline, it will be really descriptive, informative. And after publishing of the regulations, they can continue with the remaining work. We, of course, have lots of questions in that regard. And as soon as we publish the monitoring plan, lots of things will be identified, and we'll try to be more comprehensive in our monitoring plan. That's all about our plan. The session is finished right now, and tomorrow we'll have our sessions again here. And regarding the websites of the universities, we will also have some work, some presentations in tomorrow's sessions. They will be also very useful. So we are always in cooperation with the relevant institutions, and I've been really very pleased to listen to the presentations from different institutions. I thank the speakers. Now I'd like to deliver the certificates of thanks to our speakers.